And good morning. It is Wellness Wednesday on WAJR and the AJR News Network. Our guest this morning is Dr. Dave Tingler. He's a board-certified cardiologist. He's been in practice at Fairmont Regional Medical Center since 2009, has a deep background in the state of West Virginia at WVU, and from his native, that's Randolph County, right?
Yes, sir.
All right, native Randolph County. And first of all, let's start there. Tell us a little bit about yourself and where you come from.
Well, I grew up in Huttonsville, West Virginia, just south of Elkins, and I've been native West Virginia my whole life, except for 4 years I spent in the Navy, and couldn't wait to get back. And so I've been in WVU since I started medical school. Did all my training there and went straight into practice at Fairmont Regional Medical Center. Been there about 6 years.
All right, board certified in internal medicine, cardiology, and nuclear cardiology, and assistant professor of medicine with the WVU School of Medicine. How important has it been for you to keep up that relationship with WVU and WVU Medicine?
I think my personal relationship with West Virginia University has been critical to my success in my career, and part of the reason I stayed in West Virginia due to that relationship. They helped me set my office up in Fairmont, started from scratch there, and have a very thriving practice after being there for 6 years.
Mm-hmm. What type of work do you have to do to keep up not only with the advances in medicine, but just personally to keep up with the changes and the variations of what you do, what your career entails?
Well, that's a great question, because medicine in all aspects is an evolving field. Every day there are new studies, new medications, new procedures, and that's another thing that's wonderful about West Virginia University is they're up on all the latest cardiac procedures, everything that's being done across the country. As a matter of fact, some of the things that are brand new are being pioneered at the university as part of studies and the first hospital to participate in a lot of programs. So we stay up on that as a university, and then personally, it's something we have to do day by day with research and journals and going to conferences and that sort of thing. So I always tell my patients that it's West Virginia, it's royal. However, the care you receive here, the procedures you have done, should compare with anywhere else in the country.
Mm-hmm. Again, that's a point of pride with you, with WVU Medicine, with Fairmont Regional Medical Center, the fact that you keep up, that you stay on the cutting edge.
Absolutely.
All right. You're here to talk a little bit about, obviously, heart health and some of the risk factors that people put themselves in with their diet, with their behavior. Just start there. You could probably spend hours talking about people, talking with people, and talking to people about what they should and shouldn't do for good heart health.
Absolutely. Unfortunately, the biggest part of my job is taking care of folks who've already had heart problems, whether it be a heart attack or congestive heart failure, heart out of rhythm, these sort of things. But one of the things I enjoy doing with patients is trying to educate them and the public about what their risk factors are for heart disease and how they can potentially change those risk factors and potentially avoid having heart problems down the road. Another sad statistic is West Virginia ranks very high in prevalence of heart disease. We're usually right at the top of the list. With that, we also are highest in the risk factors, which include being overweight, being diabetic, smoking, and so it's no coincidence that the heart disease and those risk factors go together in our state. So it's a daily struggle and battle to try to educate patients and the public to as to what those risk factors are and how they can modify those.
You want to start with when you're young, obviously, when you're young and healthy and stay healthy. That's the goal. But I would imagine you've had some success stories with people who have come to you with problems with heart disease, and you've helped them reverse that. It's never too late, right?
Oh, absolutely. Again, my average patient is probably in their mid-70s. However, as I do this longer and longer, it seems I see more and more younger patients. I have patients that are in their 30s and 40s with heart attacks and bypass surgery. So it's not uncommon to see very young folks with heart disease. We tend to think of this as an older disease of older patients. However, because of our prevalence of inactivity, obesity, diabetes, smoking, we see more and more folks with heart attacks in their 30s and 40s. So traditionally, we think 50s and 60s and older, but again, our suspicion is very high if you have those other risk factors. If it's a strong family history, if you smoke, you have elevated blood pressure, high cholesterol, A lot of folks are inactive, get no exercise. So it's kind of playing the odds. I look at all those risk factors and the patient's symptoms and try to investigate whether this person could or could not have heart disease.
Is smoking the number one thing?
It's a good competition for what's number one. Smoking is definitely right up there. Smoking and diabetes are probably two of the most the largest risk factors for heart disease. And they're modifiable. Obviously, if you're a smoker, you can cut down and ideally quit, and that can really significantly reduce your chance of either having heart disease or having worsening heart disease. Diabetes, even though it is a condition that you can't necessarily cure, you can certainly reverse it and modify your lifestyle and make drastic changes in how your diabetes is managed and thus how likely you're going to have heart disease down the road. Diabetes, we actually treat that as a heart disease equivalent because of the prevalence of heart disease with diabetes. It's so high. When we see a patient with diabetes, we just assume that person has heart disease and treat them basically with the same medication, therapies, and guidelines that we would somebody who has known heart disease.
How can people, if they want to start, obviously smoking cessation? We've had folks in from Fairmont Regional Medical Center that talk about the programs there, and behavior modification for diabetes. I mean, those are all services offered by your facility, right?
Absolutely, and again, things that we can modify are things we focus on the most. We joke with our patients that you can't change your family history, you can't change your parents because family history is another big risk factor. And then age, males over 50, females over 60, those you can't change, but everything else can be modified. Again, smoking is a very tough habit to quit. If it wasn't, I wouldn't have such a hard time getting patients to quit. But for the patients who do, they definitely have decreased cardiac events down the road. And then the other things that can be modified include the high blood pressure and high cholesterol and again, diabetes. Those are kind of the major things that we try to work on and help modify the patient's risk.
All right. Let's say you're a middle-aged person and you start feeling run down, you start feeling like you're not yourself. Is that a sign of potential heart problems? What are the signs and symptoms of somebody who may be facing a major problem down the road if they don't address things?
Okay. So you mentioned feeling run down and fatigued. And unfortunately, this is one of the most common complaints we see, not only in the cardiology office, but in every family doctor's office. People complain of being tired and run down. So it certainly doesn't mean you have heart disease, but it could be a sign or symptom of heart disease. The things that are more obvious are chest discomfort, pain in your chest, feeling breathless, short of breath, swelling in your legs, just again, very severe worsening fatigue and malaise. Those can be signs of heart disease, especially if you have those risk factors which we mentioned. So if people have those things, it's certainly good to discuss those with your family physician, or if you don't have one, get one to be evaluated. And then most family physicians or internists start off with a simple history physical, maybe some basic labs, and typically an EKG or an electrocardiogram of the heart, and some basic tests to help figure out if there's potential heart problems. And then at that point, if their suspicion continues, then they often refer the patient to a cardiologist for further workup.
Mm-hmm. There are some simple things to start, right, in terms of tests, and if you have suspicions.
Absolutely. Most of those simple things are done before the patient ever comes to see me. The physician will order simple labs, make sure that your blood counts aren't low, you're not anemic, which could be a cause of tiredness and fatigue, and then an EKG, often a chest x-ray, and those sort of things, and often even maybe a stress test before they see the cardiologist. And at that point, if the tests are abnormal or if symptoms continue, suspicions there despite normal testing, then the patient will be often referred to the cardiologist, because we tell our patients stress tests are wonderful, however, they're not perfect. You'll hear the story often of somebody who had a stress test that was normal, and a week later they had a heart attack. That is not an uncommon thing, and so I try to reassure patients stress tests are still very good. They're probably 85% accurate in most facilities. However, that leaves 10 to 15% of folks out there who things could be missed, and that's where we as physicians have to use our judgment to not rely heavily on the test, but use it as a guide to the next step in treatment and workup.
How much does family history and genetics play into this? Because I'm sure you've dealt with otherwise healthy people that have a reasonable good weight, they don't smoke, they eat right, and they still have heart problems.
Absolutely. The family history is one of the biggest. Again, I think smoking and diabetes outweigh that, but in some families the history is so prevalent that We just have to keep a very high level of suspicion. I just saw a lady in the office yesterday. She's the last living sibling. 3 brothers, 2 sisters, all died from heart disease, younger than she is. So she already has heart disease, but was able to get it diagnosed at an early age, get on the right medications, and is doing wonderful. However, again, her family history is the reason that she was discovered to have heart disease, because her family doctor noticed that and said she needed worked up. And then, and again, I have some patients who their really only risk factor is family history. Often there's other things to go along with that. They smoke, they have high blood pressure, and family history. But again, sometimes the family history is the most prevalent risk factor. One important note is that if Grandpa had a heart attack at 80, that doesn't necessarily mean that you're at a higher risk of heart disease. We get that often in the office. We ask about family history. I usually specify to anybody young, first degree relatives have heart problems. But usually if a male less than 50, female less than 60, close relative had heart disease at a young age, that could be an indicator that you're at a higher risk.
Mm-hmm. We are with Dr. Dave Tingler, board-certified cardiologist, again in practice at Fairmont Regional Medical Center since 2009. We'll take a break here, but before we do, just talk about how you've seen that facility grow since your time there and the advancements. We've had guests come in and talk about the new advances in medicine and the equipment and the way the Fairmont Regional Medical Center has tried to keep up. Talk about the growth of the facility since you've been there the last 6 or 7 years.
Well, the growth at Fairmont Regional Medical Center has been tremendous over the past 6 years. It's going through a name change. It was Fairmont General when I came there, and I actually started there when I was in my training as a cardiology fellow. I came down on the weekends, and it's called moonlighting. You work extra on top of your training, and I fell in love with the hospital and the folks that work there and the patients, and I was really surprised for such a small hospital, the number of specialists involved there. And so that's how I ended up staying at Fairmont Regional. And in that 6 years, there's been tremendous growth. There's been growing pains and financial issues, which have been tremendously turned around. And over the past 1 to 2 years, tremendous growth. We just installed a new MRI, major renovations in the infrastructure of the hospital, and new physicians being recruited. So not only administrative, name change, and then technology, there's been tremendous growth in the past 2 years, and it's really heading in the right direction.
Fairmont Regional Medical Center sponsoring Wellness Wednesday. We're with Dr. Tingler. We're talking heart health, and we will continue the conversation on WAJR and the AJR News Network after this.
Fairmont Regional Medical Center was recently named a top performer by the Joint Commission, the leading accreditor of healthcare organizations in the United States. Fairmont Regional Medical Center was named a top performer for sustained excellence in the treatment of heart attack, heart failure, pneumonia, surgical care, and immunization. Fairmont Regional Medical Center is the only hospital in West Virginia to be named a top performer 5 years in a row. At Fairmont Regional Medical Center, we believe our community doesn't deserve better healthcare. They deserve the best health care. Fairmont Regional Medical Center. New name, brighter future. Award-winning quality care.
Hi, Toppy Kirchhoff, Talk Line on Metro News. On the last show, Ken Hall from the Teamsters saying, okay, West Virginia's got right to work. Legislature's overridden the governor's veto, but that's going to come back to haunt, he says, lawmakers who supported it.
My state of mind has changed. I've sort of switched from right to work is wrong to remember in November.
Going to be a huge political issue this election year in West Virginia. Keeping up with what's happening, Talk Line weekdays at 10:06 on this Metro News radio station.
Rocky Gap Casino Resort invites you to rock out with Weird Science live in concert on March 18th. This ultimate 80s experiment recreates the sights, sounds, and feeling of this amazing decade of pop culture. Tickets are just $10 in advance and $15 at the door. Call your friends and get your tickets today at RockyGapCasino.com.
Maryland law requires an individual to be 21 years of age or older in order to enter the gaming floor or play video lottery terminals. Please play responsibly. For help, visit mdgamblinghelp.org or call 1-800-GAMBLER.
Love the savings. Love the selection. Love a new Subaru from West Virginia's #1 volume Subaru dealer. Now, during the Subaru True Love event at John Howard Subaru, get 1.49% financing on most popular 2016 models. Payments from just $199 a month. With our huge selection, you're sure to find the one you love. But hurry, don't let it be the one that got away at the Subaru True Love event on the Mile Ground in Morgantown or 24/7 at johnhowardsubaru.com.
John Howard Subaru, outdoing the other guys every day in every way.
Have you heard? Proactive Plus is faster and better than ever. Stay tuned for a $1 million bottle giveaway, and you'll also receive free shipping. With Proactive Plus, your acne can heal and you can help prevent new breakouts. Don't miss this limited time offer. We're going to let 1 million people try Proactive Plus risk-free and get 2 free gifts and also receive free shipping when you call right now. Call 800-393-6272. That's 800-393-6272.
Hey, it's Flo, and this is my impression of a home inspector who needs friends.
Yeah, so these studs need to be 1/4 inch further apart, give or take 1/2 inch. It's gotta be just right, you know, like the coverage Progressive provides for your construction business. Otherwise, I'll have to shut you guys down. But if I do, maybe you could come out for Tuesday trivia. Fair warning, I'm kind of a know-it-all. You'll see what I mean at board game night. Hey, what's your number?
Commercial insurance that's perfect for your small business. Visit ProgressiveCommercial.com to learn more. Progressive Casualty Insurance Company and Affiliates.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Wellness Wednesday, we're talking heart health with Dr. Dave Tingler, board-certified cardiologist with Fairmont Regional Medical Center. He's been there since 2009, assistant professor of medicine with the WVU School of Medicine, and obviously a graduate of WVU's School of Medicine as well. And doctor, let's talk about symptoms. And real quick, just from personal reference, I had an irregular heartbeat that I lived with from probably the age of 13 until I was in my mid-20s, and had it corrected, was told it was not a major issue, nothing life-threatening, just a nuisance. But when it happened, it took your breath away, literally. It was a little bit scary. So talk about that a little bit, palpitations and those type of symptoms, and what can be dangerous and what can be lived with.
Yeah, the symptoms of heart disease can vary greatly, and not only the type of problem you have and the type of symptoms, but it can vary from patient to patient and between males and females. And the typical thing we ask patients is about chest pain. But it's very, very broad, and I've had numerous patients actively having heart attacks, and they are adamant that they are not having chest pain. And so it's a strange things with patients, how they describe their symptoms, and they can be sitting there with their hand on their chest in agony, and they'll tell you they're not having pain. They'll say it's a pressure. So we have to be a little more investigative with our questions as far as the chest pain. We'll often ask, are you having chest pressure, heaviness on your chest, any discomfort in the whole chest area, and especially if it's a pressure sensation, if it radiates specifically into the left arm, is often worrisome, radiation to the back, and then more worrisome if there are associated symptoms. So chest pain with associated shortness of breath, breaking out to a cold sweat, sick to your stomach, nauseous, weak. All those symptoms together can be a constellation of symptoms that could indicate a heart issue. But then you mentioned palpitations, something we see every day in the office. That could be anything from I feel my heart beating fast to it's skipping, I feel my heart beating hard, I hear my heart beating in my ear. This is described numerous different ways. And typically it's patients referring to either just a fast heart rate or often the heart skipping, what we call palpitations, which we give various names for, PVCs, APCs, these skipped or irregular beats that the heart can have. And then there's those are often benign, though very concerning to patients, and we have to make sure there's not a more serious underlying condition, such as atrial fibrillation, where the heart's completely out of rhythm, and there's some other very serious heart rhythms that have to be addressed and treated differently. But not only the chest pain and palpitations, but shortness of breath is a big one as well. And again, some of my patients they're smokers, they have terrible COPD or lung disease, and they're overweight, and so there's multiple reasons for them to be short of breath. So we look for worsening shortness of breath, and again, with other symptoms, chest pain and fatigue and those sort of things. And so chest pain, palpitation, shortness of breath, and swelling, those are probably four of the biggest symptoms.
And you can never be too cautious with your heart, right? Get it checked out.
Absolutely. We sort of joke with patients in the office, about chest pain and what the possible causes are. Obviously we say, your family doctor doesn't want to miss anything with your heart. That can kill you. If you have heartburn, usually that's not going to kill you, but it could still cause chest pain. So the cardiologist is often given the task of making sure there's no major heart issues. And luckily, a lot of times we find out the chest pain is not necessarily associated with the heart. There's numerous different potential causes for chest pain, such as acid reflux, good old-fashioned heartburn, then things like pneumonia and other things inside the lungs and chest cavity, which can cause chest pain. But again, the biggest concern with chest discomfort and pain always is whether there's something actively wrong with the patient's heart.
With men and women, the symptoms are they're completely different, right? Or they just talk about that a little bit, how they show.
That's a very good point. We've learned more over the past decade that women and men present very differently with heart disease. The classic heart attack patient comes to the emergency department clutching their chest, pain down their arm, and to be honest with you, that's less than half the patients I see that are having active heart issues. And especially in females, they will often present with very vague, atypical symptoms such as maybe back pain, again, discomfort, or just some type of weird sensation in their chest. Often no pain or really chest discomfort at all, but more shortness of breath, fatigue, I just don't feel well, something's not right. And so women, it has to be looked at with more caution as far as the symptoms. If we just ask chest pain, they say no, we stop there, we'll miss over half of our patients with heart disease. So women, and especially older women and diabetics, can be actually having a heart attack and not have chest pain. So we have to use a higher level of suspicion for females and again older patients and especially diabetics.
All right. Well, we got about a minute left. Bottom line is take care of yourself, take care of your heart. Exercise, rest, which we haven't talked about.
Right.
That helps with the stress. That helps with the stress level.
Yes, stress and inadequate rest are two big problems I see often that can cause heart problems.
All right. Stop smoking, eat well, exercise.
Yeah.
Sounds simple, right?
It sounds simple, but it is. There are things that you can change. And again, emphasize, we didn't even talk about cholesterol as a whole other category, but your cholesterol, your blood pressure, being active, eating a healthy diet. We didn't even mention really diet is a huge thing that patients can do to modify their risk. If you smoke, talk to your doctor about getting help to quit smoking. If you're overweight, try to lose weight, get on a healthy diet. We send a lot of patients to nutritionists to help modify their risk. So those are the things that you should be talking to your family doctor about and trying to modify those, because just because you have the family history and the risk factors, it's never too late to address those and reverse your risk or your heart disease.
Mm-hmm. Indeed, very good. Well, good information today. Dr. Dave Tingler has been our guest, a board-certified cardiologist at Fairmont Regional Medical Center, and we encourage you to give him a call. Fairmont Regional Medical Center presenting and sponsoring Wellness Wednesday on WAJR. Thanks for your time. Good information today.
All right, thank you.
That'll do it. We'll talk to you again for Wellness Wednesday.
There are many ways to show your family how much you care. But have you considered preparing your finances and medical plans as one of them? Hi, I'm Doreen Seaman of the Seaman Law Offices. Call the Seaman Law Offices today for a complimentary review to see how we can help preserve your finances and protect your family from the unforeseen. Seaman Law Offices, Green Bag Road, Morgantown.